So this patient's coming in for removal of an outgrowth on his left little toe. You can imagine it's starting to cause him a lot of pressure. It's hitting his shoes and all that type of thing. Nothing about this looks ominous. So while this is a soft tissue lesion, it's all more keeping with callus, or sometimes you can get giant cell tumors, which are benign. The complication this is going to present is there's not a lot of extra tissue here. So while we can shave this off, if this was even here on his foot, it's very easy to undermine and get the tissues together. This is going to be the problem. Whether we have to cauterize this or get some stitches in to pull it together as best we can, it may be somewhat open and has to heal by secondary intention. We'll have to sort of see what happens. And I expect with most of these, usually when we incise into it, probably won't be normal basement membrane. You might see like some clearer pearlescent sort of looking material because it extends probably a bit deeper than this. This is frozen already, so we already have some lidocaine underneath this. Doesn't hurt when I do that.
No.
You're okay then. All right. So this is our number 15 blade. So this is what I expected. This is what I was saying. You get this sometimes with callus or giant cell tumor. You can see some extra mass that's just there. Very benign looking. I'm going to cauterize this, and then I think I may try to scrape that out a bit more. I may even use a scalpel and apply that as well. Because if it cauterizes, if I can get it to cauterize, then this will heal better than if I try to... You can see how if I tried to pull this with stitches, there's just no tissue there. So either we're forced to do a flap, or we can cauterize it. And oddly enough, these can heal pretty well, because as the scab comes off, new skin heals in behind it. And while we still want to have a decent cosmetic result, the bigger issue here is just making sure that he's not having something swollen here that he's running into all the time. So once I cauterize this edge, what I'm going to do, I'm going to go back here. Let's see if I can actually take this out a little bit more. So I want to get down essentially almost like when we do warts or cancerous tissue. If I can get down to normal tissue, then it has a much better chance of healing in. And it's sometimes hard to appreciate what normal tissue is if you haven't seen a lot of it. But part of it is how it reacts to the cautery, and I could tell that spongy central layer was more connective tissue or soft tissue that I want to remove. So you can tell here when I push up on it, if I push the right way, I'll cut off the blood supply like that, and I can cauterize it. So this is just me cleaning up edges now. This would slough off no matter what, but I'm just doing it since I'm here with a scalpel, just to try to make that a cleaner edge. So that there's less area for this to heal through as a flatter plane. So you can see the difference that happens when I let the vessel go. So once I smooth that out, I can lower the gain on the actual bifurcator. So when I lower the gain, it's less traumatizing to the tissues. So I still want to cauterize it. And just make sure that's not bleeding in. and then we'll follow up with that over the weeks and see how that's healing in for us.